reduction in the use of disposable plastics in dental office remains very pertinent. Switching to biodegradable alternatives or reusing materials where possible. So recycling remains pertinent. Next, the next important point is proper disposal of hazardous waste. So mindful disposal of any hazardous material contamination to the environment. Sustainable resource use includes water conservation and provision of improved air quality. Eco-dentistry mostly promotes water-saving technologies such as low-flow handpieces, faucets, sterilizers that help reduce water wastage. Moreover, if you talk about the provision of improved air quality, this includes dental offices must have air filtration systems to remove harmful chemicals and pollutants. Okay, so the mainstay of this entire presentation or topic today is the Sustainable Development Goals. So these development goals are basically provided by the United Nations member states, and this was all of these 192 members of the United Nations, they all adopted these Sustainable Development Goals in 2015. So these goals are like a set of 17 interconnected targets that are aimed towards ending poverty, protect the planet, promote peace, justice, and prosperity by all till 2030. So this is also a part of the 2030 agenda. Now, these are the entire 17 Sustainable Development Goals, but the few of them which remain pertinent to climate change, climate action, and dentistry and healthcare setup includes the goal 3, which is good health and well-being. This promotes inclusive dental care, promoting preventive dental care. These are the two mainstays. Next, if we talk about the goal 6, which is clean water and sanitation. So this goal actually advocates for improved water quality for dental practices, ensuring water used for cleaning and sterilization must meet health standards. This also encourages patients to adopt healthy oral hygiene practices, which includes the use of clean water. Then if we talk about goal 10, which is reduced inequality, so this focuses on expanding access to dental care for marginalized and underserved populations, जो हमें पाकिस्तान में बहुत mostly नजर आती हैं, right? Additionally, this includes rural areas, as I mentioned, and low-income countries and communities. Now, this offering affordable dental care remains the main purpose behind it, and promoting public health education about oral hygiene eventually to reduce disparities in oral health outcomes. Moving on to the goal number 12 is responsible consumption and production. This includes reducing plastic use in dental products, the use of disposable cups and bibs, implementing recycling programs for dental materials, and using environmentally friendly dental products like mercury-free fillings, biodegradable gloves, and non-toxic cleaning materials. Now, goal number 13, which is the climate action, जो इस पूरी webinar का और इस पूरे initiative का एक बहुत main focus है, which is your climate action. Now, targets for dental practices in the umbrella of climate action remain minimizing waste by reducing the use of disposable products, properly managing hazardous materials, and recycling, eventually reducing our carbon footprint. Further, if we talk about the WHO, so WHO, which is your World Health Organization, it has a main global health role, or ये cater करता है to all the aspects of public health, which includes oral health as well. So WHO ensures that oral health is the priority globally and should be available with all equitable, effective dental services to all, must be accessible to all. Wait a second, I don't know what's going forward. Okay, so the key functions of WHO in global health include health leadership and advocacy, setting global health standards, health systems strengthening, research and data collection, global health initiatives, and capacity building and training. Specific guidelines for dental practices by WHO, which are given by WHO for dental practitioners, are oral disease prevention must be your focus, which is fluoride use, tobacco and alcohol cessation, and dental sealants. Infection controls in dental practices like sterilization, disinfection, personal protective equipments. Safe use of dental materials, which includes mercury-free dentistry, composite fillings instead of traditional amalgam, biocompatible materials, oral health education, which also remains a mainstay, patient education and health promotion. Then further incorporating oral health into primary health care, improving dental access to all, tackling all global oral health inequalities, and supporting vulnerable population under universal health coverages. Further, global health surveillance, which includes integration of oral health policies into overall health policy. Further, if we talk about the United Nations Environmental Program, which is UNEP, so UNEP advocates for dental practices and sustainability by promoting advocacy by dental associations, which includes American Dental Association. Now, the ADA has been actively involved in promoting sustainability in dentistry. It encourages dental professionals to reduce their environmental footprint by implementing eco-friendly dental practices. Now, the ADA has also supported the Eco Dentistry Association. Now, this Eco Dentistry Association is actually a very prominent organization that provides you resources, certifications, and training to dental practitioners. Now, EDA also lobbies for policy changes at the national and international levels to encourage eco-friendly dental practices. Moving on to collaborations with environmental NGOs, now non-governmental organizations like Greenpeace and the World Wildlife Fund and any other non-governmental organization often collaborate with dental associations. Now, these organizations, they focus on raising public awareness about the environmental impact of the health industry, including dental care, and work to influence policy change at the international and national levels. Further, moving on to consumer demands for eco-friendly practices, this actually involves eco-conscious consumerism. Green products and eco-friendly services has also influenced our dental community to adopt more environmentally responsible practices. Now, advocacy for consumers for sustainable oral care and recyclable dental tools has also created a market which is driven more towards eco-dentistry. Now, if we talk about certain global policy initiatives that exist today and they support eco-dentistry, so this includes the WHO Global Oral Health Program. Now, this specific program, which is launched by WHO, provides guidelines and advocacy for improving oral health while addressing sustainability at the same time. Sustainability in healthcare remains the mainstay, and WHO promotes sustainable healthcare systems by advocating for waste reduction, energy efficiency, and the use of environmentally friendly materials in all healthcare sectors, including dentistry. Further, another initiative was taken by the European Union, and they put forth certain policies which include waste framework directives and your EU circular economy action plan. So if we talk about the waste framework directives, it's basically a set of standards for the management and reduction of hazardous waste. And dental practices in EU are technically required to properly manage amalgam waste with measures in place to minimize the release of mercury into the environment. If we talk about the EU Circular Economy Action Plan, this basically promotes the use of recyclable and sustainable materials across industries, be it any healthcare industry. Now, it supports the development and the use of eco-friendly dental products and the reduction of waste in dental clinics. Now, there are certain examples of certain nations all over the world who have adopted certain national policies which cater to eco-friendly dental practices. Top of the line stays United States. The ADA has supported green dentistry initiatives by promoting energy efficient equipments, waste reduction, and the use of non-toxic materials. The American Dental Association also provides resources and guidelines for dental practitioners on how to reduce their environmental footprint. In Canada, what happened that Canada has introduced certain policies to reduce the environmental impact of mercury in dental practice. Now, the Dental Mercury Pollution Prevention Program, which was launched by Canada, mandates the use of amalgam separators in dental office to prevent mercury contamination altogether. Canadian dental regulations have additionally encouraged the adoption of sustainable dental materials. Moving on to another example, which is Australia. So the National Australian Sustainable Dentistry Council, this is a council that advocates for sustainable dental practices in Australia. Now, the council works to raise awareness about eco-friendly materials, water conservation, energy efficiency, and energy efficient equipments in dental care. Now, the Australian government has also introduced several regulations around dental waste disposal, particularly concerning mercury amalgam. Now, there have been certain global agreements on pollution control. The mainstay for that now remains the Minamata Convention on Mercury. Now, the Minamata Convention is basically a global treaty, which Pakistan also is a signatory of. It is aimed at reducing mercury pollution. It specifically addresses the use of mercury in dental amalgam and encourages countries to phase out its use or at least reduce its environmental impact. Many countries have ratified the convention, and dental practices are required to adopt amalgam separators and switch to a safer, more sustainable material. Now, if we talk about government policies on eco-dentistry in Pakistan, so the top of the line is your Minamata Convention on Mercury. Now, Pakistan being a signatory to Minamata Convention on Mercury, it aims to protect human health and environment for anthropogenic emissions and releases of mercury and mercury compounds. Now, Pakistan still, however, dispose of amalgam waste improperly, such as in sinks, regular trash, and lack amalgam separators. Secondly, Pakistan Environmental Protection Agency, the PAK EPA, is currently operating under the umbrella of Ministry of Climate Change, and it is tasked with enforcing regulations related to environmental protection, including waste management and pollution overall. However, there is a proper environmental protection agency that is established with proper guidelines. They still lack implementation. There is no specific mandate which addresses dental waste, especially mercury-containing materials. Further, if we talk about the Pakistan Medical and Dental Council, which is the PMDC, this regulates medical and dental education and practice, has not still yet incorporated sustainability and eco-dentistry principles into the curriculum or accreditation standards. Now, because of this lack of integration, there is a lot of hindrance to the promotion of environmentally responsible practices among dental professionals. National Health Policy of Pakistan, while addressing various aspects of health, does not specifically focus on oral health or sustainable dental practices. Now, this omission reflects the broader neglect of the environmental conditions within countries' healthcare policies. Now, if we talk about certain challenges that may come in the way while adopting or phasing towards eco-dentistry, the first challenge that comes is your high initial cost. Next, we have the lack of education, limited access to sustainable materials, regulatory barriers, which includes our policy limitations and the limitations towards implementation, and the resistance of change, which is being a Pakistani, there is this reluctance towards even accepting that even climate change is a reality. So there's still certain factions of the society that still believe that climate change is a mere myth and not a reality. So this mindset will obviously be eliminated when there is public awareness and mass education. Now, the solution and best practices include eco-friendly equipment. We must plan a phased implementation of eco-dentistry, focusing on energy conservation and waste reduction first, followed by more sustainable investments in renewable energy or mercury-free materials. Furthermore, education and awareness programs are necessary. So dental associations like Eco Dentistry Association can partner with local dental societies and schools to offer training programs focused on sustainability, green technologies, and waste management in dentistry. Now, partnerships with suppliers and manufacturers to establish a network of trusted partners and suppliers that may provide you with biodegradable and eco-friendly dental tools. Now, if we talk about the involvement of government stakeholders, this includes governments can enforce regulations on dental waste disposal, particularly with respect to mercury, and encourage water fluoridation and other preventive measures. Public-private partnership also is quite important because it will help improve access to green dental technologies and training programs. So the government could also introduce sustainable healthcare frameworks as seen in other countries like Denmark, Canada, to address waste management and green health infrastructure. NGO and civil society collaborations and organizations can also partner with dental schools to integrate eco-dentistry into their curriculum. And they can also collaborate with local communities to provide eco-friendly dental services, especially in rural and underserved areas. For example, in Pakistan, NGOs like Green Pakistan could partner with dental sector to promote eco-friendly products, offer subsidized sustainable materials, and lead awareness campaigns on the benefits of eco-dentistry. Public awareness campaigns, we can use social media, newsletters, local campaigns to inform the patients about the importance of sustainability, tell them of how climate change and environmental sustainability is not a myth but a reality. In dental care, how sustainability can be endorsed, and encourage them to ask their dental care providers about eco-friendly options. Government policy and regulation collaboration with government agencies and healthcare organizations to further push towards the development of national policies that integrate eco-dentistry into broader healthcare system. For example, we can push for mandatory mercury amalgam separators in all dental offices or create incentives for practices to go green. Lastly, collaboration with NGOs and advocacy groups engage with global environmental organizations like UNEP, Greenpeace, WHO to stay informed about global sustainability initiatives that are being taken globally and incorporate relevant strategies into dental practice in Pakistan. So we must adopt sustainable practices. We must advocate for policy change. We have to educate and engage, and we must seek collaboration with stakeholders. Thank you.
I must say you have a gift for communicating complex ideas in a clear, concise manner. So thank you for sharing your knowledge. And I think our participants would agree that it was a very good presentation. Guys, if you have any questions for Dr. Barda, kindly ask them in the chat box. I do not think we have any questions because it's a very new topic. It's a very it's the sort of topic that's not been explored before. It's not been talked about. It's not been discussed. So I think you've given us enough to think about And okay, so Dr. Azra, we have a few questions. Dr. Azra, she's asking, thought to practice eco-dentistry in Pakistan, Dr. Adil. Very good initiative. If you do that, then I think we will achieve something here. Dr. Azra Nas is saying, what upcoming policies or initiatives promote eco-friendly dentistry and how can practitioners prepare for them? Like, are there any policies being implemented in Pakistan or any initiatives that are promoting eco-friendly dentistry in Pakistan? Dr. Azhar Naz is asking. Okay. Can you kindly unmute Dr. Bertha? I think she muted herself. Uh, Dr. Bertha?
Assalamualaikum. So, yes, to address Dr. Azra's question, see, in Pakistan, currently change is a very new topic. It's very nascent, especially when we try to integrate it in healthcare setup. So, as I mentioned, in Pakistan, yes, we do have certain policies, like we are a signatory to the Minamata Treaty, which is the mainstay of this entire green dentistry initiative and this green dentistry facade, if I may say. But what goes behind all of this, that if we really want to implement it in Pakistan, we must start by public awareness. We must, as practitioners, start, learning about what practices we must adopt in order to, decrease our carbon footprint. So the main roots to all of this is education and educating ourselves and awareing ourselves along with the public about what eco dentistry and what uh, environmental mess we are creating as people, as masses, as dental practitioners, as industrialists, or as any professional or non-professional person, a civilian of this country. So what goes behind is actually education. So we must start educating ourselves and the masses altogether.
Okay, we have another question from Dr. Adil. Rather, it's a statement. Doctor, we are facing a lot of challenges in meeting SDG goals, especially climate change. Therefore, in dentistry also will face like situation. There's your Dr. Varda, would you like to answer that? Dr. Varda, kindly don't mute yourself because it's moderated and then you cannot unmute yourself.
Okay, I'm so sorry. Okay, to address Dr. Adil's statement, see, I do understand कि altogether हमें sustainable development goals को वैसे ही achieve करने में issue हो रहा है, but that's not only Pakistan. Globally, all countries are facing these challenges. हम challenges को face करते हुए, we cannot, be scared or be like, or start procrastinating about it. Okay, so what I believe is today is a new day. If if we are committing towards this goal and we want we will achieve this goal, then we can. So be it like small steps, but we have to start it today and we have to start implementing. The only problem of why we are not able to achieve our goals, be it in any realm of life, is only because we are not implementing the already existing policies that are very well crafted and very well present in our society, in our government levels, in our any setup possible. So all we need to do is focus towards implementing and not be scared ke aage kya hoga.
Okay, so there's another statement from Dr. Fatma Muhammad Ali. She says, don't you think not only climate but in Pakistan finance is also an issue? Government hospitals use amalgam to have reduced costs for patients.
यस, बिल्कुल ऐसा ही है जो डॉक्टर फातिमा कह रही है, बिल्कुल बिल्कुल ऐसा ही है. आई अग्री टू दिस. And to and a suggestion which I also mentioned in my presentation to overcome this is public-private partnership. Right. So we do have a lot of so what public-private partnership exactly is that how when public organizations get this, I'll just ease it out. Well, when public organizations are going to get these certain funds on the basis of partnership, ठीक है, जिससे आपके जो इस तरीके के एक्सपेंसिव एजेंडाज होते हैं वो fulfill होते हैं, right? So this is just a very basic definition for public private partnership, but yes, we have a lot of industrialist overall. And then जब आपका वही बात कि जब आपकी जो आपका एम और आपका गोल और आपकी जो आप अचीव करना चाह रहे हैं वो इतना ज़्यादा इम्पोर्टेंट है, इतना क्रूशल है, then of course international organizations, international donors like WHO, UNEP, ECO, ECA, everybody is going to support you altogether.
So we have a question from Dr. Anas Raza. He's saying, I belong to a rural area of Sindh. How can I promote eco-friendly dentistry in my area?
Start by public awareness. And here in especially in rural areas, public awareness वहां से शुरू नहीं होती कि आप eco dentistry पे jump करें. No, you have to start from very basic. At least try to make them understand that environment and climate change एक रियलिटी है, एक मिथ या अंग्रेजों का कोई एजेंडा नहीं है, राइट? बिकॉज हमारे यहाँ पाकिस्तानी मैसेज का माइंडसेट इसी तरीके से चलता है. So what you need to make sure is that they at least agree with you that yes, climate change and environment is actually some sort of a myth, is some sort of a reality and not a myth. And when you start changing their mindset towards that, that is when they're going to accept eco dentistry. Additionally, one more thing what I can do, it is very unconventional uh, of for like us dentists to say that, but you can always integrate some of these Islamic values into these conversations. How is, for example, biodegradable, मैंने बात की थी about bamboo and biodegradable toothbrushes, right? Your tools for dentistry. Now what you can promote is miswak. Why don't we promote that? So this is also one of the examples. And then obviously we do have Islamic and cultural and religious backing to it. So obviously they will eventually start changing their mindset. So yeah, that's how you can deal with people in rural or the masses of Pakistan actually.
Okay, so we'll wrap up the session. Thank you so much, Dr. Verda Fatma, for giving us time
Thank
and
you.
meeting us on this topic. Guys, I would urge you all to kindly fill the forms shared in the message box, and we can move to the next session. We have Dr. Rabia with us.
Assalamu alaikum,
Dr.
everyone. Am I audible? Assalamu alaikum, everyone. I'm Dr. Amar Ahmed, Marketing Director at Pride. It is my pleasure to introduce our next speaker, Dr. Rabia Anis. Primarily a dentist, Dr. Rabia earned her BDS from LUMS in 2011. With a growing interest in teaching and academic development, she later pursued a master's in health professions education from Aga Khan University. She currently serves as an assistant professor in the Department of Medical Education at LUMS, Jamshoro, where she actively collaborates with various departments to enhance medical education across the institute. Please join me in welcoming Dr. Rabia Anis.
Assalamu alaikum, everyone. Am I audible?
Yes, ma'am.
Okay, thank you so much, Rahmat, for your kind introduction. And a very good evening to everyone joining from different areas. First and foremost, I'd like to thank the organizers of this inspiring eco-friendly dentistry virtual summit 2025 for inviting me. And it's an absolute honor to be among such passionate change makers and dental professionals who just not care just for smiles, but for the planet behind them. And what a wonderful presentation by Dr. Warda Fatima, although the topic was really new, but she presented very nicely and answered the questions very nicely as well. So I would like all of you to raise your hand virtually or mentally if you have asked ChatGPT to write a prescription or patient note lately. कभी आपने ChatGPT से प्रिस्क्रिप्शन नोट लिखवाया हो, या फिर कोई पेशेंट के नोट्स लिखवाए हो, या फिर any notes you have asked ChatGPT to write it for you. So I can see if any one of you raise hands or not. Oh, ये तो किसी ने भी यूज नहीं किया आज तक ChatGPT. I don't know if that option is available or not to raise the hand. I'm not sure about it. Anyway, so now I just wanted to say that imagine if that same artificial intelligence could also help us reduce waste, optimize energy, and promote greener care. So that's exactly what we are going to explore today. So these are the this is the session highlight for today. So let's start with the why behind this conversation. Why does dentistry needs to go green? So dental practices by nature generate a huge amount of waste, as Dr. Varda also discussed. We know that dental practices जैसे gloves हैं, suction tips हैं, impression trays हैं, to X-ray films and paper-based records. So we are talking about tons of disposable materials per clinic per year. And add to that the intense water and energy use. ठीक है, high water and energy consumption is also happening. कैसे हो रही है? We all know कि sterilization की वजह से lighting है, dental chairs के compressors हैं, autoclaves हैं, all of which that run for longer hours. And then there's an indirect carbon dioxide emission, which we usually don't think of. Just think about every patient visit, every staff commute, or every courier delivering the supplies, all contributing to our carbon footprint. For example, impression लेना है, impression lab जा रहा है, impression lab से आ रहा है, आपके पास अगर जो है वो facility नहीं है X-ray की, so you are sending your patient to another facility for the radiograph. So this is all also contributing to our carbon footprint. So as you see in the last point, this is not a luxury topic. Green dentistry is not a trend. We must say that it's a necessity, especially हमारी country में, Pakistan में, जहाँ पे energy and waste management already it's under stress. So to further visualize the problem, let's look at where exactly our environmental impact is coming from inside a typical dental clinic. अगर हम typical dental practice की बात करें, पाकिस्तानी dental practice की बात करें, तो ये environmental impact मतलब कहाँ से ये चीज जो है हम कह रहे हैं कि जी ये dental waste आ रहा है. So clinical waste, आप अगर if you see this diagram, so clinical waste comprises of 30%. Think of suction tips. अब clinical waste में क्या क्या चीजें आ रही हैं आपकी? Suction tips हैं, cotton rolls हैं, protective equipments हैं, sharp containers हैं, amalgam waste है. So these are regulated materials that require special disposal, and they carry a heavy footprint. And other factor is that plastic disposables that contributes to around 25%. उसके अंदर कौन कौन सी चीजें आ जाती हैं? आइटम्स लाइक सिंगल यूज कप्स हैं, बिप्स हैं, ग्लव्स हैं, प्लास्टिक रैप्स हैं, इवन पैकेजिंग. सो मोस्ट ऑफ विच एंड अप इन लैंडफिल्स. देन कम्स वाटर यूजेज, जैसे हमने पहले भी बात की, एट 20%. जैसे हाई स्पीड हैंड पीस हैं, अल्ट्रासोनिक स्केलर्स हैं, कंज्यूम लार्ज वॉल्यूम्स ऑफ वाटर, स्पेशली not monitored or upgraded. जैसे डॉक्टर वर्दा ने बताया, we have options now. We can upgrade to the better versions of those equipments. Then the paper waste is about 15%. पेपर वेस्ट में क्या चीजें आ जाती हैं? फॉर्म्स हैं, अपॉइंटमेंट स्लिप्स हैं, बिलिंग डॉक्यूमेंट्स हैं, पेशेंट एजुकेशन ब्रोशर्स हैं, राइट? सो मेनी ऑफ दीज कैन बी डिजिटल टुडे. सो दिस इज हाउ वी कैन कंट्रोल एट आवर लेवल. हम अपने जो है कॉन्टेक्स्ट में अगर सोचें तो दिस इज द बेसिक फ्रॉम विच वी कैन स्टार्ट. फाइनली हम देखें अगर इस डायग्राम में, सो ट्रेवल कार्बन डाइऑक्साइड इमिशन इज 10%. Again, I talked about it that it contributes like from patient visits, staff commutes, lab pickups. Okay? So this is a hidden burden, but it is a significant burden. So when we talk about green dentistry, we are addressing all of this. And that's where, artificial intelligence comes in, not just as a cool technology, but as a way to systematically reduce each one of these. हमारे लिए artificial intelligence तो बहुत पुराने जो है वो दौर से आया हुआ है. लेकिन, but now we are getting aware of how we can use artificial intelligence to make our home a smart home, our clinic a smart clinic, our educational practices a smart educational practices by integrating different AI tools in our educational practices. इसी तरह से हम बहुत सारी चीजें ऐसी हैं जो we can explore. We can educate ourselves, we can educate our teams, we can educate our junior dentists, we can educate our technicians, so that we can start with small scale, right? Okay, so now what we understand the environmental toll of routine dental practices. Let's explore that how artificial intelligence can actually help us to go green, right? So first के AI जो है that can reduce the need for disposables. ठीक है, कैसे हो सकता है रिड्यूस? बाय शिफ्टिंग टू अ डिजिटल वर्कफ्लोज, लाइक आप इंट्राओरल स्कैनर्स यूज करते हैं इंस्टेड ऑफ ट्रेडिशनल इंप्रेशंस. वी मिनिमाइज द यूज ऑफ इंप्रेशन ट्रेज, alginate and disinfectants. Then AI supported simulations in dental education also cut down on physical materials. There are so many applications now. If you go and explore different fields में, आप local anesthesia देखें, आप cavity preparations देखें, so there are many simulations applications which are virtual simulation applications which you can use to teach your junior staff or technicians के किस तरह से हमने उनको educate करने के लिए हम उसको भी use कर सकते हैं. Secondly, AI automate scheduling. So smart scheduling systems that reduce idle chair time, limit energy consumption, and prevent staff burnout. So when the day runs efficiently, so does your carbon footprint. It is like that. Then पेपरलेस सिस्टम्स का क्या मतलब है कि इट इज अनदर विन. AI बेस्ड चार्टिंग आप कर सकते हैं, वॉइस टू टेक्स्ट रिकॉर्ड्स यू कैन बिल्ड, राइट? एंड क्लाउड बेस्ड स्टोरेज सिस्टम्स होते हैं दैट eliminate unnecessary paper use, contributing directly to sustainable goals. Lastly, AI powers teledentistry and remote triage, right? For instance, chatbots होते हैं या AI assisted image analysis होते हैं that can handle minor concerns without a physical appointment. So this means fewer car trips for patients, less traffic and less carbon dioxide emission. मतलब आपका patient एक दफा आपके पास आया है and now he just have to know something about the follow-up and he has to again travel back. So you can modify things like that. आप उसको automate कर सकते हैं, आप अपना chatbot create कर सकते हैं which can serve your patient, right? Okay. So AI powered sustainability solutions की हम बात कर सकते हैं. If you see this Venn diagram, on the left we have artificial intelligence, right? This includes जैसे digital workflows आ गए, automation systems जैसे मैंने बात की, AI assisted diagnostic tools हैं, smart appointment scheduling है, ये सारी चीजें आ जाती हैं इसमें artificial intelligence में. On the right we have this area is sustainability, which includes eco-friendly practices जैसे reducing plastic waste, saving electricity, minimizing unnecessary procedures, and going paperless. And in the middle, you can see that it is green dentistry, where both of them combines. So we have the overlap here. That's where the magic happens, which is green dentistry through artificial intelligence. So now, current use cases की अगर हम जो है वो बात करते हैं कि क्या क्या चीजें हम कर सकते हैं, but then again हम कौन सी प्रैक्टिसेस की बात कर रहे हैं? हम बहुत established practices की बात कर रहे हैं या हम बेसिक प्रैक्टिसेस की बात करें जी, यू नो वी हैव डिफरेंट क्लिनिकल सेटअप्स, राइट? अकॉर्डिंग टू द एरियाज वी हैव डिफरेंट क्लिनिकल सेटअप्स. सो फर्स्ट वी हैव AI इन डायग्नोस्टिक्स. रेडियोग्राफी में यूज करते हैं, जैसे मैंने कहा स्मार्ट स्केजुलिंग में यूज कर सकते हैं. इन्वेंट्री सिस्टम होता है, स्मार्ट इन्वेंट्री सिस्टम होता है. वी हैव एप्लीकेशंस फॉर दैट. फॉर एग्जांपल एक जीरो डेंट AI होती है, राइट, दैट एनालाइज योर यूजेज पैटर्न्स एंड ऑटोमेटिकली फ्लैग लो स्टॉक आइटम और इवन ऑटो जनरेट द परचेज ऑर्डर्स. तो फिर ये इन्वेंट्री जो सिस्टम्स हैं, ये जो सॉफ्टवेयर हैं, यू हैव टू बाय दो सॉफ्टवेयर for your own clinical setup. Then if you have a budget for that, you can do. But if you don't have a budget, then we can have a look on an other options, right? इसी तरह से we have voice to text systems. डॉक्यूमेंटेशन एक बर्डन होता है बहुत सारे डेंटिस्ट के लिए. सो AI बेस्ड जो वॉइस सिस्टम होते हैं, जैसे ड्रैगन मेडिकल वन होता है या फिर गूगल वॉइस रिकग्निशन होता है, दैट अलाउ अस टू डिक्टेट नोट्स व्हाइल डूइंग द प्रोसीजर. So extraction done under local anesthesia and boom, it's already typed onto the patient's record and it is ready to verify. So these are the softwares which again are already making dental practices more efficient and environment friendly. So एक study थी जो मैंने पढ़ा जिसके बारे में, so I thought I should summarize it for you. So that was a dental practice decided to go green, right? Not with the expensive tools, but with easy staff-led changes. And the results were inspiring. Let's walk through how they, इस study में उन्होंने patient से अलग perspective लिया, dentist से अलग perspective लिया, और जो है वो practicing technician से अलग perspective लिया. They wanted to know, मतलब अगर आप अपने even रिश्तेदारों में जाके पूछें कि आप कौन से dentist को visit करना चाहेंगे, so they are very much concerned about going to a dental practice. यार हमें ना इस तरह की dental practice होनी चाहिए, कहीं sterilization compromise तो नहीं है, कहीं है. So every person from whatever economical background he has, he prefer to choose the best for him or his family, right? So वहां पे उन्होंने सबसे जो है वो परसेप्शंस लिए एंड देन दे क्रिएटेड अ प्लान और उसको फिर उन्होंने इम्प्लीमेंट किया. सो व्हाट दे डिड वाज कि फर्स्ट था कि रिड्यूसिंग अननेसेसरी ग्लव यूज, राइट? अक्सर स्टाफ जो है वो बिना जरूरत के भी ग्लव्स पहन लेते हैं, राइट? कि अभी ओके फाइन कॉल आई है, कॉल अटेंड कर ली ग्लव्स के साथ, देन दे आर रिमूविंग दोज ग्लव्स एंड देन दे आर using another glove. ठीक है, पेशेंट के जो करने के बाद दे आर राइटिंग सम नोट्स. इवन डेंटिस्ट डू दैट, दे आर राइटिंग सम नोट्स, तो उन्होंने जो है वो दोबारा ग्लव्स पहने और वो पेन से जो है नोट्स लिख रहे. दैट इज द अननेसेसरी यूज ऑफ ग्लव विच यू आर डूइंग, that you can control. So different posters, different pictures से आप आपको भी, अपने फेलो डेंटिस्ट को भी और अपने स्टाफ को भी ट्रेन कर सकते हैं कि भाई जहां पे जरूरत हो आप वहां पे ही ग्लव्स पहने. ठीक है, सो दैट यू कंट्रोल द प्लास्टिक वेस्ट हियर. देन वेस्ट सेग्रीगेशन पे उन्होंने बात की कि दे इंट्रोड्यूसेस अ डुअल बिन सिस्टम. क्लीन कंटैम, अब बहुत सारी प्रैक्टिसेस ऐसी हैं ऑलरेडी. वी नो दैट यू हैव अ डुअल बिन सिस्टम कि भाई कंटैमिनेटेड वेस्ट एंड नॉन कंटैमिनेटेड. सो क्लीन नॉन कंटैमिनेटेड आइटम्स वर मूव्ड फ्रॉम क्लिनिकल वेस्ट टू रेगुलर ट्रैश बिन्स. सो वी शुड नो दैट किस चीज को हमने विच आर द आइटम्स जिसको हमने कंटैमिनेटेड वेस्ट बिन में डालना है एंड विच कैन बी थ्रोन इनटू द रेगुलर ट्रैश बिन्स. सो इससे वेस्ट डिस्पोजल का खर्चा भी कम हुआ, ठीक है, और एनवायरनमेंट को भी फायदा पहुंचा. थर्ड वाज प्रोक्योरमेंट एंड स्टॉक. उन्होंने क्या किया कि दे ऑर्डर्ड इन बल्क एंड शिफ्टेड टू द रीयूजेबल टूल्स. छोटी छोटी चीजें बार बार मंगवाने के बजाय एक ही दफा ज्यादा क्वांटिटी में मंगवा ली. ठीक है, सो दिस यू शुड नो कि आपकी कितना यूजेज है. सही है, इससे आपके पैकेजिंग का वेस्ट भी कम होता है. ठीक है, और ये भी है कि आपको एक्सपायरी देख के अपने स्टॉक को ऑर्डर करना हो. Then energy efficiency. Motion sensor lights लगाई, ठीक है, so you can put those motion sensor lights whenever it is important to switch on the light, then you can do that, right? So staff को भी आप encourage करें कि lights और machines off करें when they are not in the use, right? उसके बाद water conservation. A water audit helped identify leaks and misuse. So again water audit उन्होंने किया कि water audits जो है वो के विजिट्स हों, वो ऑडिट किया जाए कि भाई वाटर का कहीं से कोई लीकेज तो नहीं है, कुछ नहीं है. सो वी नो कि भाई वाटर का टैप्स खुली रह जाना, रिंसिंग के दौरान एक्स्ट्रा वाटर का यूज होना, ठीक है. सो सब एवरीथिंग वाज बीइंग एड्रेस्ड, राइट. उसके बाद टीम इन्वॉल्वमेंट. डेफिनेटली staff themselves led the process. Regular meetings हुई, posters हुए. जब whenever you are working in a team in a dental clinic, so you have to include each and every person working in a dental clinic, no matter he's a senior dentist, no matter he's a junior dentist, no matter he's a technician, no matter he's a receptionist. So टीम वर्क इसी तरह से होता है कि आप जब कोई मीटिंग करते हैं या जब कोई डिस्कशन करते हैं, तो यू शुड हैव ऑल द स्टेक होल्डर्स ऑन द टेबल, बिकॉज यू नेवर नो कि टेक्नीशियन के पास जो थॉट है वो शायद उसके माइंड में जो आइडिया है टू कंट्रोल ऑल दीज थिंग्स, वो बेहतर हो आपके पास आइडिया से, राइट. सो देन टीम वर्क का यही फायदा होता है. तो व्हेन यू आर डूइंग रेगुलर मीटिंग्स, यू आर ऑल्सो टेकिंग स्टेक फ्रॉम देम. तो वो अपने आप को ज्यादा रिस्पॉन्सिबल फील करते हैं कि यार नहीं, हमारी भी वैल्यू है, ठीक है, हम जो कह रहे हैं उसकी भी वैल्यू है, राइट. एंड यू कैन एजुकेट थ्रू द सेम प्रोसेस. ओके, सो जब मुझे ये टॉपिक मैंने डिसाइड किया कि मैं ये टॉपिक जो है वो डिस्कस करूंगी विद माय फेलो डेंटिस्ट, तो I prepared a short survey, and I wanted to know the perception of my fellow dentists, that how, what do they think, उनका क्या यूज है एआई परसेप्शन, उनका क्या परसेप्शन है अबाउट एआई एंड उसका यूज इन पाकिस्तानी कॉन्टेक्स्ट. सो वी सर्वेड, अच्छा जितने सर्वेज थे, आई थिंक 61-62 डेंटिस्ट अक्रॉस स्पेशलिटीज ने जो है वो सर्वे फिल किया. So roughly 51% have used AI in some form. Most commonly, they have explored tools like ChatGPT or diagnostic softwares, although clinical usage is still emerging of these applications. इसी तरह से 69% respondent believed कि AI will play a major role in the future of dentistry. That shows a clear anticipation of transformation, but with caution. Then over 70% agreed that AI improves diagnostic accuracy and treatment planning. So there's a strong optimism here that they are willing to trust AI if it enhances care quality. Then, but only 30% feel confident explaining AI tools to their teams or patients, right? That means that they are not well equipped, they are not well trained. So this is where we see first major gap. Awareness is growing, but actual understanding is limited. Then definitely they are, almost 63% were concerned about ethical issues like patient data privacy, decision accountability, and algorithm transparency. So this shows a mature understanding of the risk involved. Then interestingly, 70% said they would be more likely to adopt AI if it is contributed to environmentally friendly practices like reducing plastic waste, paper use, or energy consumption. So they are ready to do that. So the intersection of AI and sustainability matters to them. Then around 69% wanted training, specifically focused on how AI can support sustainable dentistry. So this means that intent is there, but the support system is not. So we identified these gaps. We can work on that, and then mutually, we can improve the system. Then already there was a question in which I asked what AI tools they were using. So, this is the list you can see: ChatGPT, Perplexity, SciSpace, Quillbot, Turnitin AI, Firefly, then Overjet, DynoCAD, Dent AI. इसमें से बहुत सारे तो मुझे भी नहीं पता थे. So it was new. They were new to me as well. But already ये चीजें use हो रही हैं for diagnosis, treatment planning, and workflow automation. ठीक है, few people are doing that. So जो लोग use कर रहे हैं, I think they have more responsibility that they should guide the people who are struggling with the use of these applications. Okay, so this again survey का जो था implementation के AI for sustainability हम किस तरह से जो है वो कर सकते हैं. So you people highlighted the urgent need for evidence-based resources. जैसे SOPs हैं, peer-reviewed tools हैं, practical case studies हैं to guide implementation. These were the suggestions from you people. So this is the data which we have collected. We have to work on it, and then we can, mutually rise above the level. Then many emphasize education and training, faculty development, right? To incorporate AI literacy into the dental curricula, जैसे Dr. Varda ने भी कहा था. A major concern raised was infrastructure. Practitioners stressed the need for stable internet and improved digital readiness, especially in under-resourced areas. Technology access also stood out. Tools need to be both affordable and user friendly. Definitely हमारे context में यही होता है कि हम बहुत ज़्यादा हम हर practice को cater करना है. हमें उस प्रैक्टिस को भी केटर करना है जो एक बहुत छोटे से गांव में एक क्लिनिक है और एक बहुत पॉश एरिया में एक क्लिनिक है, राइट? सो वी हैव टू गो फ्रॉम देयर टू देयर. तो हमें हर लेवल, हर एरिया, हर इकोनॉमिक बैकग्राउंड के लोगों को किस तरह से हम फैसिलिटेट कर सकते हैं, दैट वी हैव टू डू. देन फाइनेंशियल सपोर्ट डेफिनेटली, अगर आप इंस्टीट्यूशन में हैं या वो इंस्टीट्यूशन की ओपीडीज रन कर लें. देन प्रैक्टिकल एआई इंटीग्रेशन स्ट्रैटेजीज जैसे smart scheduling hai, shifting to digital records, enabling these were the suggestions as well. So these insights show that dental professionals are not only aware of sustainability challenges, they are also ready with solutions. So our job is to act on. So from awareness to action, हम बात कर चुके हैं AI simulation की. So let's start with simulation. Excellent way to reduce material waste while boosting clinical skills. So virtual reality, haptic-based simulators let students practice without using plastic teeth, impression materials, or disposable gloves over and over, right? So if you are working in a setup which has a training probability, right? So you can use simulations to educate your students. देन ऑनलाइन ट्रेनिंग इसकी काफ़ी जो है वो ये मूक FDI सस्टेनेबिलिटी पे वर्धा ने ऑलरेडी बहुत सारी चीज़ें डिस्कस की हैं. दे हैव डिफरेंट चेकलिस्ट. आप जो है ना डिफरेंट उस पर काम कर सकते हैं. डिफरेंट गाइडलाइंस हैं, डिफरेंट पॉलिसीज़ हैं. यू कैन गो टूवर्ड्स दोज पॉलिसीज़ एंड यू कैन लर्न हाउ यू कैन मेक change. Like एक तो ecodentistry.org था, एक future learn है. So these are the practices. ये free courses भी होते हैं, ठीक है, and where you can जो busy practitioners हैं या students हैं वो जाके इसको like इनके पास जो checklist है उनको follow कर सकते हैं कि okay fine हम किस तरह से improve कर सकते हैं, right? इसी तरह से smart dashboards जो digital tools होते हैं that track your clinic's utility usage. कि वाटर कितना यूज हुआ, एनर्जी कंजम्पशन क्या है. इवन बेसिक टूल्स लाइक जैसे गूगल शीट्स है उसको भी आप कंबाइन कर सकते हैं विद मंथली यूटिलिटी बिल्स दैट कैन क्रिएट अ पैटर्न एंड हाईलाइट वेस्ट, राइट? सो दीज आर द वेज यू कैन reduce the waste. Then smart practices and greener practice. So let's talk about the patient side, because sustainability isn't just what we do to clinics, but we empower patients too. Patients का भी तो हमें उनको भी तो train करना है, right? So chatbots to reduce in-office consults, ठीक है, by integrating AI powered chatbots हैं into practice websites, ठीक है. आप chatbot create कर सकते हैं. Zapier में मैंने एक chatbot create किया है. I would request Rehmat to please share the chatbot link of Zapier. आप लोग उस पर क्लिक करें. So that is my chatbot which was prepared for Maya Dental Care, right? अब उसमें मैंने अपनी information डाली हुई है, अपनी dental practice की information डाली हुई है. I have trained that chatbot के क्या directives अगर आते हैं तो उस पर क्या आपको respond करना है. So even if you write के आज मैं extraction करके आया हूँ और मेरी like bleeding is bleeding stop नहीं हो रही, what should I do? This medication is not available, which medication should I take, right? So Maya Dental Care की तरफ से वो chatbot trained है. Even you can train your chatbot कि ये मेडिसिन नहीं मिलेगी तो ये खानी है, साइड. तो जब पेशेंट उनसे पूछेगा तो पेशेंट को वो उसी तरह से रिस्पॉन्ड करेंगे जैसे आपने अपने chatbot को ट्रेन किया या जो डायरेक्टिव्स आपने उसको दिए, ठीक है. देन वर्चुअल हाइजीन कोचिंग, ठीक है, लेस प्रिंट मोर इम्पैक्ट. Instead of handing out paper-based hygiene instruction, we can use virtual coaches. आप जो है वो infographics use कर सकते हैं, video tips use कर सकते हैं, different जो है वो platforms use कर सकते हैं. So zero paper waste आपका use होगा. Then custom visuals, right? So one of the most exciting tool is AI generated visualizations. I can now interpret X-rays and produce annotated images or even short explainer videos for patients. So आप patients को storytelling के जरिए उन videos के जरिए बहुत कुछ explain कर सकते हैं. So that can create more understanding, reduce repeat appointments and eliminate the need for printed reports. So to wrap up, smarter communication with patient not only saves time, it builds greener and more efficient practice. So as we come towards the close, let's reflect on what we can do starting today to make our practice greener and smarter. So you have to train your team with digital tools. Train your team, your colleagues after getting yourself trained. Empower your staff to confidently use digital solutions like AI schedulers, e-records, smart inventory systems, even basic tools like Google Sheets or Trello boards can reduce paper usage and streamline workflows. Then educate patients using smart paperless AI apps. Instead of handing out printed brochures, use platforms that send customized dental hygiene tips or treatment reminders straight to the phones. Like apps like Dental Coach hai, ya phir WhatsApp automation aap kar sakte, can support eco-friendly patient education. You have to start small and then you have to scale up. Use digital charts, reduce plastic, monitor waste, right? You don't need to come, आपको सब कुछ इकट्ठे आप नहीं कर सकते. Begin with digital charting, opt for reusable items like stainless steel impression trays, and monitor daily waste to identify problem areas. So smart tools, smart people, and green dentistry. So this isn't just a formula, it's a mindset. With the right tool in the hands of a proactive team, sustainable dentistry is not only possible, it is practical. Thank you so much. I would like you all to be part of the survey which I was doing before this presentation. So Rehmat will share the link and kindly submit the forms. And if you have any questions, I'm here to answer your questions. Thank you.
Ma'am, we have a question.
Okay.
How can we implement the green dentistry and this AI techniques while working in government dental hospital and school? And as I'm tech savvy, but working in a government setup, most of the times it makes senior dentists and professors angry if we try to implement digital things in our clinical works or use studies or article in our OPDs.
Okay, so बिलाल, very good question and very practical question. ठीक है, ये मसला है और इस मसले से हम इस मसले में इसको हम improve कर सकते हैं. So you have to start first with yourself, because आप जैसे मैंने छोटे छोटे स्टेप्स बताए ना कि आप क्या कर सकते हैं, एंड यू बीइंग आप जूनियर लेवल पे हैं, बट यू कैन ट्राई विद स्मॉल स्टेप्स कि आप किस तरह से पहले आप एक प्लान बनाएंगे रिड्यूस वेस्ट कैसे करना है. यू हैव टू एजुकेट योर लोग कोलीग्स. यू कैन ऑल्सो डू अ सर्वे. देखें, जब आप स्टूडेंट लेवल पे होते हैं ना, व्हाट यू कैन डू ऑलवेज इज रिसर्च इज द मोस्ट इंपॉर्टेंट थिंग विच यू कैन डू. वट एवर यू आर ऑब्जर्विंग, यू वॉन्ट टू चेंज इट. जब भी आप you want to bring a change, you have to report something which is happening around you and you want to change it. ठीक है, तो सबसे पहले तो आपको उस चीज को सर्वे करना है. आपको ये चीज जो है वो हायर अथॉरिटीज तक, या to convince people, you have to report कि this thing is happening. So definitely जब आप ये करेंगे, उनको एक रिपोर्ट प्रिपेयर करके देंगे कि and you have if you have a plan how to reduce that, तो फिर हो सकता है कि आपको उसमें सपोर्ट मिले. राइट, अगर इसी तरह से आप खुद इम्प्रूव करेंगे अपने लेवल पे कि आप किस तरह से चीजों को मिनिमाइज कर सकते हैं, वेस्ट को कैसे मिनिमाइज कर सकते हैं, कैसे आप एप्लीकेशंस को एक्सप्लोर कर सकते हैं, यूज कर सकते हैं. सो डेफिनेटली जब आप कर रहे होंगे और आपका कोलीग देखेगा कि यार दिस इज अ वेरी स्मार्ट मूव टेकन बाय मोहम्मद बिलाल, सो आई थिंक आई शुड ऑल्सो अडॉप्ट इट. एंड देन अगेन, जो प्रॉब्लम आपने आइडेंटिफाई की उसको अगर आप रिपोर्ट करेंगे, then it will, I think, work better with the higher authorities.
Yes, ma'am.
If
Another
you are
question.
satisfied, Bilal.
Another question by Dr. Azra Naz. Ethical considerations arise from the use of AI in Pakistani dental practice. How can addressed?
Right. So you are very right, Azra. Ethical considerations, देखें, जब भी हम AI applications यूज करते हैं तो उसके हमें बहुत सारी एथिकल कंसिडरेशंस हैं जो हमें केटर करनी चाहिए. राइट, ठीक है, कि हम प्रॉपरली यूज कर रहे हैं, नहीं कर रहे हैं. लेकिन इफ आई एम यूजिंग वन एप्लीकेशन, तो ज़रूरी नहीं है कि अगर हम किसी रेडियोग्राफ के लिए हम कोई टूल यूज़ कर रहे हैं तो वो इट इज़ गिविंग यू द राइट इन्फॉर्मेशन, राइट, या फिर हम अननेसेसरीली जो है ओवर यूज उसका कर रहे हैं. सो डेफिनेटली एथिकल कंसिडरेशंस हैं, एंड people are still they have challenges in controlling the ethical issues. So I think we are still struggling with this part, and कि जो भी बड़ी बड़ी applications हैं या बड़े बड़े softwares हैं उसके ethical use को कैसे control किया जा सकता है, it's still I think debatable, और अभी इस चीज पे इतना ज्यादा जो है वो हम शायद बात ना कर सकें for the ethical considerations.
One more question, ma'am. What are the good and bad things about using AI in Pakistani dental clinics?
Okay, so good thing is if you are using it for positively, अगर आप उसको यूज कर रहे हैं, गुड देखें अगर आप उससे ट्रेंड हैं, अगर आपको पता है कि उसका सही तरीके से इस्तेमाल कैसे करना है, then definitely the result or the outcome would be good. ठीक है, but if you don't know how to use it, because many of us we know the applications but we don't know how to use it, we don't know how to give prompt to those AI tools or application, and then that is the place where we mess up with the AI, and it is giving you wrong references, it is giving you wrong information, it is guiding you in a wrong way. So definitely if you know how to use the applications, how to use artificial intelligence intelligently, then only it will give you positive outcome. अगर आपको नहीं पता, अगर आप उसको जो है properly use नहीं कर सकेंगे, if you are not using your own mind, if you are completely relying on that application, and if you are completely relying on artificial intelligence, it definitely will have a negative impact. So you have to use your mind as well. So your mind plus AI will make a greener future. That's what I believe.
Thank you so much, ma'am. It was such a insightful and detailed session. Thank
You're
you.
welcome. Thank you so much, everyone, for patiently listening to my talk. Thank you so much.
अस्सलाम
Now,
वालेकुम एवरीवन. डॉक्टर अहमद, आपने मुझे और डॉक्टर ताहिरा को म्यूट कर दिया, अनम्यूट कर दिया. And I hope I am audible. Please let me know in the chat box, am I audible? Okay, ji, amazing session by both of the speakers. Assalamu alaikum, everyone. I am Dr. Tuba Osman, Virtual Event Director at Pride. Welcome to our third session of the Eco-Friendly Dentistry Virtual Summit. We're excited to continue our journey, and I'm delighted to introduce our esteemed speaker, Dr. Tahira Heather, for today's session titled Sustainable Smiles, Eco-Friendly Oral Hygiene from a Periodontist Perspective. Dr. Tahira Heather, a dedicated clinician, researcher, and consultant periodontist, holds a Bachelor's of Dental Surgery and MDS in Periodontology. She serves as Assistant Professor and the Head of the Department of Periodontology at Fatma Jinnah Dental College, and is a proud member of the American Academy of Periodontology. With 6 national and 3 international publications, she continues to advance her clinical excellence and scientific knowledge in the field. I had the privilege of completing my house job under her supervision, and I'm honored to introduce her today. We're truly honored to have her share her expertise today. Let's warmly welcome Dr. Tahira Heather to the session.
Hello, Assalamu alaikum. I hope I'm audible now. Hello. Okay. Assalamu alaikum, everybody. I'm so happy to be here. Thank you, Tuba, for the wonderful introduction. And initially, when I was asked to speak on a different topic, I did not think I had enough to share with regards to the topic of sustainable dentistry is such an important topic, but unfortunately, I don't have that level of education. And I said, what new thing can I introduce, or what else, what's something that you guys don't know already? But then I thought about it. I have been teaching dentistry since the past 15 years, and there have been countless people who have, educated on oral hygiene. And that is something each one of you will go forward and they go and they teach their friends, their families, their patients how to maintain oral health. And that's a responsibility upon each and every one of us. Whoever is practicing as a dentist or is not, you are supposed to be knowledgeable on the on oral health, on oral hygiene care. And हम हर तरीके से, some of you may say that, okay, electric is better. Some of you may report certain articles which say electric is more efficient, but, and then someone may say, oh, water floss is better, flossing is better. But are we looking at whether or not they're sustainable? So today I am going to speak a little bit about that. I don't know, I'm not able to share my screen. Okay. Right, so I'm going to share my screen. And this is my topic. We're talking about oral, it's an eco-friendly, and sorry, can you see this? Let me just move this. Can you see this now? Can everybody see it? Please up unmute करके बोल लें, because now I can't see the chat. Okay. Right. So we're going to talk about eco-friendly oral hygiene. This is a topic I thought which is very relevant to me also, because I teach each and every patient that comes to me, whether or not they have a complaint. I give a very comprehensive discussion. I do a very comprehensive discussion on oral hygiene, how to improve it, and that's a responsibility that each one of us has to fulfill. And I always encourage my students as well that this is something you give to your patients for free. So when you do scaling, you charge them. When you do anything else, consultation, you charge them. But when you're giving oral health instructions, you're not charging them, but you are giving them something that will not only impact their oral health, but it can also impact the environment. So we're going to speak a little bit about that. Just a brief introduction. A lot of you may not know me. I am a periodontist by specialty. I did my master's in periodontology from Ziauddin University. And I'm now currently working as an assistant professor and the head of department of periodontology at Fatma Jinnah Dental College. It is one of the oldest dental colleges, and as far as periodontal treatments are concerned, it's Alhamdulillah a college which is really doing a lot, giving back to the community. Also, we get a very interesting cases. So, I'm the students who graduate from Fatma Jinnah, they're very blessed in that because they get to see a wide variety of periodontal conditions. And hopefully every one of us is making an impact on the community as well. I also do private practice, which is just not limited to periodontics, it's also general dentistry. So if anyone of you ever has questions, wants to, what's any kind of, my opinion on anything periodontics related or otherwise, please feel free to contact me. So we're talking about eco-friendly oral care, and we have to look into why are we focusing upon this. Now, internationally, sustainability is a very hot topic. It's an important topic. Anything that is important is anything that is important internationally is also, sorry, I have to move this, also has implications in our setting. So this is going to be topics that are actively being researched upon. So, for example, if you like something about, if you find some topic interesting, and if any one of you wants to get into research, you can actually carry them out in our population. For example, we're going to talk a lot about the oral hygiene tools, but there's been a lot of studies done internationally, but locally नहीं हुई है. So, it's good to find new things, find out things, what are our options, and what are the environmental impacts of every oral health tool. Now, we're going to discuss this in a bit more detail. Remember, as oral health educators, it is our responsibility to inform our patients about sustainable options. So, हम सब कहते हैं दांत brush करो, soft brush, don't use hard, blah, blah. But are we thinking about what impact is having on the environment? Right, so we are not just looking out for ourselves. So these are tools which will obviously, inshallah, implement in our daily oral health practices, but will also help educate our patients. So the purpose of this lecture is actually twofold. Right. So if we just look upon toothbrushes, regular toothbrushes, we are discarding over 23 billion of them. And of course, all of us know what a toothbrush looks like. They're multi-bristles. Some of them have, 1,600 bristles in one of them. Imagine we're throwing away 23 billion of such toothbrushes. We can avoid that. I mean, there are other options. And all of us know it's plastic, of course. It's a lot of nylon, absolutely non-biodegradable. And besides that, of course, all of us know how important it is to floss. But floss is also nylon and Teflon. So that's also something which is non-biodegradable. And eventually, of course, the environment, we break it down. So it converts into microplastics. And microplastics eventually leak into the water system. And from our normal sewage water, it goes into the sea. So eventually, the bottom of the food chain, it reaches the marine life. Okay. So when you talk about our health choices as far as oral hygiene products are concerned, we're not just looking at the products that we're using, we're also looking upon our programs. So, for example, and this because this topic has already been discussed in some detail, our practice should be as sustainable as possible, and that's something that's a responsibility. Thing is, you start small. You start with whatever you can. For example, I try to do a lot of things on, and I know for a fact. Okay, for example, if you're working with somebody, so obviously you cannot. I mean, उनका file system है, you have to adapt to that, right? But small, उसमें as much as we can enter things digitally, that's better. So we have to do whatever we can in different capacities. Remember, so we are, of course, looking at our periodontal treatment. That's one thing. The good thing about periodontology and general dentistry is that our procedures don't use a lot of plastic products. And we all know that, right? And all of you know that the man was killing key, you did not use plastic, anything plastic. When you did ultrasonic, you did not. You know where you can save wastages, which you can avoid wastages, but we don't have things which basically use a lot of plastics. But where we can focus, where we can actually control is the prescription. So this is how the products are so important. And of course, we are wired to say that certain products are better. For example, we say, of course, electric brushes, but whatever. Sorry, for XYZ toothpaste is better, XYZ toothbrush is better. We taught that. But is it really true? Are other sources or are more sustainable options not as good? We are going to discuss that, okay? Remember, the more you recommend a product, सब कहते हैं 9 में से 10 dentist. So obviously, every patient will say, हमें pain relief करना है, we want healthy teeth. If this product is better, we'll buy it. But that's where we come in. We can tell them that yes, you can take care of your oral health while taking care of the environment. So when we talk about sustainable options and a lot of things we know, obviously all of us know, we have three major things, which is the toothbrush. I'm going to discuss this in some detail. Toothbrushes, all of us have seen at some point a bamboo toothbrush. Acha, as far as oral health tools, oral hygiene tools are concerned, something मैं हमेशा अपने students को कहती हूँ and I encourage people is to use the products yourself. So for example, if you haven't used a bamboo toothbrush before, because I use that, I honestly do, उसलिए मैं यहाँ भी लिखा हुआ है. I use bamboo toothbrushes and they're perfectly fine. Yes, they're a bit hard. So I would not maybe give them to somebody who has recession, all of that, but they are sustainable and they are good and they're efficient. They're a bit expensive, but they do the job. All right. The other thing that you can do is that you can use an electric brush. Now, electric brush, according to research, is also more efficacious, is more effective, but it requires, besides the head, you don't need to change the whole machine. So compared to plastic toothbrushes, remember, electric are more sustainable because the major motor doesn't get replaced. Toothpaste and mouthwashes, very interestingly, even in Pakistan now, you will see a lot of tablets available. And those tablets, especially mouthwash, they work perfectly well. So they're chlorhexidine containing mouthwash tablets. You put them in a glass of water, easy to store, easy to use, not taking plastic. So it's very effective. I'm going to discuss this थोड़े से और detail में आगे जाके, right? So as far as bamboo toothbrushes uh, are concerned, you'll easily find them in Pakistan. ऐसा नहीं कि पाकिस्तान में available नहीं है. And bamboo is a very effective tool as well. It's 100% plant-based, right? So this is something I would encourage all of you to go back, look into it, try to use it yourself, and only then you should encourage. But once you use a product, you know how effective it is. Acha, the second thing I'd like to talk about, and nobody talks about it, even when I was searching about, sustainable options, online search kari thi, nobody mentioned miswak. But not many of you know, but my research topic in my master's was based on miswak. Iska jo naam hai, the chemical name is Salvadora persica. And because it was part of my research, and of course, like I wouldn't know it if I hadn't researched upon it, but it is a very effective tool. Of course, it has religious implications. A lot of people use it because of that. The good thing is that all the ingredients are natural. And it has everything that even the best toothpaste will not have. It has antiviral, it has antibacterial, it has anti-inflammatory, it has anti-bleeding components. It has everything in low concentration. So everything that a good toothpaste will have, it'll have that and some more. So very effective in plaque reduction. The WHO has also recommended it. So, and now you know if something is recommended by WHO, it is definitely efficacious. How you use it, I'm just going to tell you a little bit about it. It's like, I hope some of you have at least seen it. Pakistan, you've even seen it literally on the roadside. It's very effective. And the problem with it is some people don't use it properly. Acha, the first thing is like, it's like a little shank. It's like a branch. You bite upon it, and then this frail, you see this end, it comes off. This is the equivalent of the bristles. So this is going to brush it. Now, in a regular brush, the brush handle is 90 degrees to the bristles, but this is at 180 degrees, so it's straight. What this does is, दो चीजें की होती हैं, just because of the angulation, this is the bit of technical part. Some people, what they do is, they skip the lingual surfaces. So that's one problem. So people end up brushing the outer surfaces, they skip the lingual surfaces, but even iska thoda angle change karke, like you can turn it, you can cut it at an angle, and you can easily clean the inner surfaces. Miswak, because I was also doing my research, because I always say you should use what you prescribe. I used it. I found it very effective. Will I replace it? Will I say that don't use toothpaste, use this? I'm not sure. But honestly, even I have used it a lot of times. And during your fasting hours also, you can use it. So a very effective tool, people who use it, tell them how to use it properly, and they don't even need a toothbrush. So remember, this is also a sustainable option that not many of us go back to, or not many of us recommend. You will have patients like me, for example, I teach at FJ. Some patients, don't find it easy to buy a 300-400 piece toothbrush. And this is perfectly fine. Isko sahi tarike se use karo, it's going to work. It's a bit technique sensitive. It's not as easy, but it does the job. It's very effective. Okay. And I've also reported some studies. I actually also did a review article on this, which I didn't add here because I didn't want it to be about my research. But I actually went back and I did a whole review on miswak. And it's very, very effective. So lots of studies which show that it is as good as a regular brush. Another thing is water flosser. Now, water flosser is something that I recommend a lot. They do say that it's not as effective as a regular flosser, but for people who have a lot of prosthesis, if they've got some gaps, if they've got gum loss, if they've got black triangles, very effective tool for cleaning the interdental areas. And I hope all of you have at least been introduced to it. And in Pakistan, you will find now the international brands, which are Philips and Waterpik, very easily available, a bit pricey, but you'll also find some Chinese products. Now, why I'm mentioning is this, because हम कभी search करते हैं, या for example, we look for something, we should find it in every market, but you should find it on Daraz. The Chinese version you'll easily find it on Daraz. The international ones, you'll find it at Springs. Times Medico has it at a very good price. Naheed has it. All of these places have it. So remember, you should use it yourself too, and you should also prescribe it to your patients. The good thing is that it is reusable, of course. You use it. I've had the same water floss since the last 5 years. That's how good it is. So you get a good product, it will last you a long time. And it comes with different tips. So I use the classic tip, but depends upon which one you require. So I'm going to add a video here. Just going not going to.
Brushing alone is.
Sorry, I'm just going to.
If you just
Just
brush, food
add a
debris get left behind. Warm
part
water
of
in
it.
place firmly. Number one, set
From here. Just to show you the angulation.
now and can place. Start with lowest pressure setting. Lean over the sink and place the tip in your mouth. Turn unit and water on. Partially close lips to prevent splashing and let water flow from your mouth into the sink. Aim the tip at the gum line. For best results, start with your back teeth. Move along gum line, pausing briefly between teeth. Floss front and back side of teeth for 1 minute a day. The Waterpik water flosser removes up to 99.9% of plaque from treated areas and is up to 50% more effective than string floss. You can have healthier gums and brighter teeth.
Right. The point of adding this, I don't want to market Waterpik. I do use Waterpik. I find it very effective. But just to say that water flosser is something that all of us must know as oral health educators. Your patients require it, and in a lot of cases, it does is as good as as a regular floss. Another tool which is sustainable is the tongue scraper. Now, I know all of us are more used to using the backside of the toothbrush, but if you're using a bamboo brush that doesn't have the tongue scraping option, a metal tongue scraper is something, again, that I use. It is a fantastic product because before I got this one, I used to use the back of the toothbrush as well. The toothbrush typically has two lines on the back surface, which can be used to clean the tongue. But the scraper is a fantastic oral hygiene tool. All of you must get it. The metallic one, I got it off Daraz. It's available in a lot of stores also. It's very effective. And I've written it down also. So what you do is that you start from the middle. So you don't start at the back. You're going to end up gagging. Middle में आप start करें, bring it back and forth a couple of times. Clean it every time. So I always keep tissue, clean it, and then do it again. Once you start doing this, in a couple of days, you'll notice a difference in your tongue. We don't even realize the number of bacteria, all the debris that has collected on our tongue. So it's very important that we do it. And we focus so much upon brushing and flossing and interdental, etc., but we completely forget about tongue scraping. And all of us must do it. But only when you do it yourself will you be able to remember to remind your patients about it. And it's just not for halitosis. There's a common mindset, that halitosis hoga, then I will prescribe it. No, you're going to prescribe it to everybody so they keep their tongues clean. It's that simple. It's for everybody. It's just not for people with halitosis. The metal one. So basically, in the market also, you'll get both plastic and metal. I haven't used the plastic, but there's enough literature which says that plastic is not as effective. If the patient gags a lot, if he has difficulty with the metal, then you can switch. But again, metal is sustainable, is fantastic. You can use it your entire life. Kharab nahi hota, of course. Just keep it very, very clean. So again, my topic was actually very specific, and I like to keep my lectures not too long. So the purpose of delivering this lecture was to basically inform all of you of what your options are as far as oral hygiene practices are concerned. And you have to be convinced yourself in order to educate the other person. So if there's a topic you don't believe in, or if it's a product you don't believe in, you're not ever going to prescribe it. So remember, the oral health tools that are available that are sustainable are also very effective. Same like I've used the mouthwash tablets as well. They are effective. It's just the fact that we are just so used to a certain few names and that's our comfort zone. हम कहते हैं कि oh, we know this brush is good, we know this brush is available, etc., etc. But are we realizing what implication it's having on the environment? These things we have to keep asking ourselves. So remember, all of us are prescribing toothbrushes, toothpaste, mouthwashes to patients. We need to do it think while we think of the environment as well. So we need to maintain a kind of a balance between both. Acha, another thing I just added this here, that you have to communicate to the patient, right? And you have to make it easy for them. So, for example, you can tell the patients options. A lot of patients in nowadays, because patients are very knowledgeable as well, especially, for example, if you have patients coming from abroad, because they practice all of these things a lot more than we do. So they will want to know what their options are, right? And if you inform them, if the patient is caring about a sustainable environment, so they will definitely go for the option which is greener. And especially when it comes to toothbrushes, flosses, water, all of these are very important. And sometimes you can also tell them in terms of life cycle. So, for example, you may not realize it, but what is the eventual life cycle of a piece of plastic? And it's only when we realize this, when we look into the numbers, when we look into the wastages, that's when we take a step. Just like saying, somebody said the other day that plastic straws are not very, sorry, paper straws are not very effective, but you realize what a plastic straw does. So only when you realize the implications will you make a small change. And oral health tools are something that we use every day. So we may think it's a small change, but it's actually a very big change. Even if you're able to convince 10 patients to switch to bamboo brushes, it's a big deal. Another thing, this is the last thing I do myself. I like keeping QR codes, and you'll see end lecture, presentation maybe. I've added a code. The code makes our life easy because remember, we're in digital time. Now, nobody remembers. Yes, some people will take a screenshot, but they might not actually go and purchase it, right? So, for example, if there's a product you like for example, I like a particular water flosser. So I add the water flosser ka code, and that person can go click the code. It takes them to that link on the RAS and they can purchase it directly. It makes it easier. Anything that makes things easier, there are greater chances of the patient changing the behavior when the other tools are easily available. So if you have them in your office, you can sell them. If you have links, you can do that. You can WhatsApp them to them, place a QR code. These are different options. Right? So for all of you, this is my message. Use bamboo toothbrushes yourself. Try to encourage your family members as the first step. And second step, you can tell your patients as well. Metal tongue scrapers, if you don't use tongue scrapers, please do it. Life-changing is a fantastic tool. Will really make a difference and without impacting the environment. Electric toothbrushes also, I am a fairly big fan, very effective. And they are better for the environment compared to your regular brushes. Water flossers, silicone, so interdental brushes also, they come in different shapes and sizes. Silicone brushes are very effective, as good as most flossers. So this is basically not, I don't want to expand too much, but depending upon the area, depending upon the size of the black triangle or the interdental space that is, you basically decide the size of the interdental brush. So if there's a gap, remember the floss will not do much. The floss's role is when the teeth are intact and then when the gingiva is in place. When there's loss of interdental papilla, you need other tools, and that include water flosser and interdental brushes. The last thing, I know people keep talking about it, conserve water as well. So of course we're looking about plastics, but the other thing is you must remind your patients, especially children, and young pediatric patients, that they must conserve water while brushing. And it may seem something very small, but at the end of when you're toothbrushing, at the end, just spit out the toothpaste and don't use water again. That also makes a difference because you need to keep some toothpaste adhere to the tooth surface. So that's the end of my lecture. If you have any questions, you can ask me right now. I've also added a QR code, which is basically the link to my Instagram. If anyone has questions, I'm sorry, I'm a bit like I'm sometimes or I skip something happened and I just miss certain messages or they never reached me. So just message me again if that happens. And I'm always here to help all of you. If I've got any questions, any queries, any help required with the subject or with anything else dental related or otherwise, please feel free.
Thank you, Dr. Tahira. We do have some questions in the chat
Yes,
box.
please. Yeah, please. Wait.
So,
How
Dr.
do I stop
Yamina,
sharing?
yeah, Dr. Can you, are you reading yourself or you
No, no,
want
I'm
me to read?
no, no, I'm sorry. I was just stopping. Yeah, yeah, wait.
Okay. So, Dr. Yamina Rahman is asking the difference between bamboo and maswak, which will be recommended.
All right. So bamboo is a replacement for. Okay, sorry. Let me just tell you. So bamboo is a replacement for your regular toothbrush. So you use it just the way you use a regular toothbrush. With that means with a paste. It's not to be used by itself. So you need to use it alongside a toothpaste. Miswak is something that you use as a standalone thing. You don't need toothpaste with it. So miswak, I would say that, for example, you've got house help, you've got even your regular patients, you can use it yourself, you can use it during fasting hours. Why I don't say that miswak can be a complete replacement, because we're kind of conditioned to believe that fluoride kitna level of toothpaste required hai. So because there has been no study which has compared the efficacy of the antibacterial components or the enamel repair components of miswak versus toothpaste. So I wouldn't say that in a general day or oral hygiene routine, you shouldn't completely replace it, but I think you can also use it alongside. It has its benefits. But the difference is that a bamboo toothbrush is just a brush, and miswak has active components. So that's one of the differences. Okay.
Dr. Arisha Ayman is asking, isn't there possibility of microbial growth over maswak since it's
You,
wet after using?
yeah, yeah. So it is, it definitely is. So I don't know, whenever I use it, I cut it. And you can cut it. So I know एक दफा वो लोग करते हैं, they reuse it. I prefer to cut it every time. But that's basically because I don't use it 5 times a day. I use it once or twice. But you can wash it. And toothbrush में तो you can also use same होता है ना. You use, for example, even with the toothbrush, there's a chance of bacterial colonization. Of course there is. Just wash it.
Arva is asking, what would you prescribe patients undergoing orthodontic treatment? Which option is more eco-friendly for them?
Prosthodontic treatment.
Or orthodontic treatment?
Orthodontic. Okay, so for orthodontics, you will have to use a combination, which means that you can use interdental brushes and you'll get silicone ones as well. I'll tell you, orthodontic, remember you have to look at into so you have to look at the around the bracket and between the wire and the tooth. So in that plane also, right? So braces के patients can remember, I don't think a maswak will be very effective because उसकी angulation difficult होएगी. So use a regular brush or bamboo brush, electric brush. You can use electric brush, and then use interdental tools. And water floss also helps. So you can do a combination. So for example, if you think now again, you're going to look into the price points as well. Water floss is expensive. Electric toothbrushes are expensive. So if you're looking into it, maybe OPD patients, maybe they will not, just like you can't expect them to spend 40,000-50,000 rupees on the oral hygiene tools. So perhaps you can look into it from that aspect. If you think the patient can afford it, a very good combination for them is electric toothbrush and a water flosser. And if you don't think that they can, then a bamboo.
Dr. Azra,
Sorry.
okay. No, you may continue.
Yeah, so and if you think the patient cannot afford, like, or if you think you don't want to give something which is very expensive, so then you can do a bamboo brush as well. But uski aur cheeze hoti na, like you have to make sure that the patient is able to clean between the wire and the tooth as well. It's very important. A floss will not go through, so you'll have to use a interdental brush.
Dr. Azra Naz is asking, what are the key benefits of adopting eco-friendly oral hygiene practices from a periodontist perspective?
Okay, so the thing is, I gave a periodontist aspect, which means that things which will effectively clean the tooth, right, or clean the gums, clean the mouth, while being eco-friendly. And why is it important? Because just like I said, this 21 billion toothbrushes are discarded every year. That's a big number. It's a lot of plastic. So the more eco-friendly we go, the better it is for the environment. And if you can, see, we should make our impact. We should try to do something for the environment, no matter how small it is. And it starts from yourself. So even if you yourself say, I will not use a electric tooth, sorry, not use a a regular toothbrush and I'll switch to bamboo or I'll switch to electric because I will not be discarding that much plastic. So you're making a change. You're making a change for the better. We have to be informed ourselves so we can inform other people.
Thank you so much, Dr. Tahira, for the
My pleasure.
enlightening presentation and patiently addressing all the questions. We are truly, truly grateful to have you here. Thank you so much.
Thank you.
Everyone, I hope I'm audible.
Yes, Dr. Kamal.
I'm extremely grateful to all the esteemed speakers who have designated their precious time for today's summit. Dr. Tahira, Dr. Varda, Dr. Rabia, your session was very insightful, very informative. Thank you very much. We are extremely sorry for the disruption because of the internet disconnectivity today. Let's begin with the session of Dr. Azan. I'm Dr. Saman Sultan, serving as the Digital Engagement Director at Pride. With a background in dental surgery and academic teaching, I'm committed to supporting initiatives that elevate the standards of dental education and public health awareness. Today with us we have Dr. Azan. Dr. Azan is a graduate of Liaquat University of Medical and Health Sciences, where he earned his Bachelor of Dental Surgery. He went on to complete a fellowship in oral and maxillofacial surgery as an active member of AOCMF, a prestigious global community for cranio-maxillofacial specialists. He also holds a certification in implant dentistry, completed under the mentorship of Dr. Nurul Wahab at Ziauddin University, reflecting his advanced clinical training in surgical and implant procedures. Currently, Dr. Razan is further enhancing his leadership capabilities by pursuing an executive master's in healthcare management, combining clinical excellence with strategic healthcare leadership. This session explores the often overlooked environmental consequence of surgical practice in oral and maxillofacial settings, highlighting how healthcare systems contribute to ecological degradation. Dr. Razan will discuss practical strategies for minimizing waste, promoting sustainable materials, and adopting eco-conscious practices without compromising patient care. Emphasis will be placed on how clinicians can take a leadership role in fostering environmentally responsible surgical protocols, advocating for green hospital policies, and contributing to a more sustainable future in dentistry. Let us all welcome Dr. Razan. Please, sir.
Thank you so much, Dr. Saman. I hope I'm audible to everyone.
Yes, sir, you're audible. Thank you for joining.
Okay, that was a great session by Dr. Tahira. I loved it, especially the bamboo toothbrush and the miswak part was great. Okay, so I'll just share my presentation. I'll just share my screen. Okay. Can everyone see it?
Yes, not now, sir. Yes, sir,
Not
it's
now?
visible. Thank you, sir,
Okay.
it's visible.
No. Okay, so environmental impact of maxillofacial surgery, right? So to start with, is it really worth discussing कि भाई हम बात ही क्यों करें इसके ऊपर कि we are helping people with the surgery, we are impacting lives, but what else are we impacting? We are impacting the environment. This was a paper published in 2023. It basically a case study. Review paper है ये कहता है कि भाई healthcare waste is a serious problem. What it did was it compared the waste that was generated from different hospitals around the world. So yeah, so to put it into perspective, let's discuss. US जो produce करता है that is around 8.4 to 10 kgs per bed per day. Greece is around 0.3 to 3.6 kgs per day. India is around 0.8 to 2.3 kgs, and Ethiopia is around 1.1 to 1.8. So let's talk about India. Our healthcare system is more or less comparable to them. So if we are producing like around 2.3 kgs per bed per day, and to let's say कि हमारा एक hospital है, AKU is around 560 bedded hospital, तो if we multiply 560 by 2, कितना kgs waste produce होता है by a hospital? And this is the complete waste. ना इसके अंदर everything is added. The hazardous, non-hazardous, everything. And this is just for AKU. सही है? Let's say, let's talk about Civil Hospital Karachi. Civil Hospital Karachi is a 1900 bed hospital. ठीक है? 1900 into 2.3. Do the maths, people. Okay? So, let's talk. I hope everyone knows what maxillofacial surgery is. Okay? What we deal with. We are out of the OPD setting and we are more of into OR setting. So, yeah. So, because we are treating the patients in an OR setting, we are dealing with the maxillofacial trauma. आपका एक trauma के case, if we are having a panfacial fracture, that is including your midface and your mandible, takes around more or less like 3 to 4 hours, okay, with a whole IMF and fixing and reduction and everything. So what will be the implication of it in the OR? हम तो यार खड़े होते हैं OT के अंदर, फुल-ऑन मतलब किट शिट पहन के PPE पहना हुआ है, AC वेसी चल रहा है, लाइट्स वाइट्स ऑन है, बड़ा मजा आ रहा है, पेशेंट ऑपरेट कर रहे हैं, ये वो अंडरग्रेड आ रहे हैं, पिक्चर्स ले रहे हैं, लाइक बहुत सोशा बनी हुई है, बट व्हाट इज द इम्पैक्ट ऑफ इट ऑन द एनवायरनमेंट? ठीक है, पैथोलॉजीज हम लोग डील कर रहे होते हैं सेम, एक कैंसर तक केस इज अराउंड लाइक 4 to 5 hours. Congenital and acquired defects, if we perform an orthognathic surgery, that is again around like more or less 5 or 6 hours. In the hand of an experienced clinician, around 4 hours. Then again, complex reconstructive surgeries. Okay, so what it requires in the term of resources, हम लोगों को क्या क्या चीजें required होती हैं? First of all, surgical armamentarium. Surgical armamentarium में सब कुछ आ जाता है भाई, from the knife to the skew and everything in between. इसके अंदर usable चीजें भी हैं और disposable चीजें भी हैं, ठीक है? Then the energy. I'm talking about the energy that is required to like run the place, right? Electricity उसके लिए required है आपको भाई. I'm just gonna come up कि कितनी इलेक्ट्रिसिटी यूज करता है एक वार एक घंटे में, ठीक है? Then anesthetic gases, of course. What is the implication of that on the environment? The sterilization, water use. Just now Dr. Tyra ने बात की about the water use. That was, we need to talk about the water use, people. आज बारिश हो रही है, like about, I think it was the last time it rained in Karachi was 360 days ago. एक साल बाद बारिश हो रही है कराची के अंदर, ठीक है? So we need to talk about the water use. We need to take about conserving water. And then, of course, resource transport. You are going to take a biopsy. Yeah, you are going to take impression. It is going to go somewhere else. It is going to go, it needs to be transported. आप लोग अपनी टाइम और एनर्जी दोनों चीजें बर्न करते हो उसके अंदर, ठीक है? तो लेट्स टॉक अबाउट दैट एज वेल. Okay, so surgical armamentarium. We have a single use instrument. अच्छा, अब some practices, I'm not talking about everyone, but some practices, यार चस्का होता है, reusable चीजें दिखाते हैं उनको, पेशेंट्स को, पेशेंट्स को अच्छा लगेगा, and like they're gonna be like, oh, ये तो one time use चीजें कर रहे हैं, तो there's no chance of plus infection. तो भाई, we need to educate the patients and stop these practices. Single use instruments. चलो, आपके पास अगर कोई हैव सी का पेशेंट आता है and you like not sure about your sterilization, तो वहां पे तो आपने यूज कर लिया, but what is the like, क्या है जरूरत है भाई एक प्लास्टिक इंस्ट्रूमेंट यूज करने की, like Dr. Tyra said. Then we have drapes. Drapes, single patient, in talking in the terms of drapes, आप एक पेशेंट को पूरा कवर करते हो, you are using like a 6x6 sheet, वैसे 4 शीट्स आपकी पेपर की यूज हो रही है, just in that. सही है? आपका एक रीयूजेबल पेपर, this is your recycle discardable paper. इसके बरक्स we have good proper sheets made out of linen. They can be used as well. They are just as fine. ठीक है? Then the suction tubing and the packaging materials. Packaging material need to be talked about. Normally, जो हम like what in the maxillofacial practice and in some clinics, as I've seen, all of the instruments are packed together. Normally, एक चीज होती है जो हम mostly use कर रहे होते हैं, mirrors और probes. भाई आपके जो टेक्नीशियंस है टाइम और पैसे बचाने के लिए सारे जो आपको मिरर है सब एक साथ पैक कर दिया, ठीक है। देन दे आर गोइंग टू जस्ट ओपन इट अप एंड जस्ट गिव इट टू यू, दे आर गोना बी लाइक यू आर स्टेरिलाइज्ड, इट इज नॉट स्टेरिलाइज्ड, ठीक है। आस्क देम टू पैक इट अप प्रॉपर्ली इंडिविजुअली, ठीक है, एंड देन यूज इट लेटर ऑन, ओके। नेक्स्ट अप, okay, so we are going to talk about the energy consumption. uh, it is from the general anesthesia, the electrosurgical units, the lifeline, and the imaging and the heating, ventilation and AC systems, right? इन सब चीजों को चलाने के लिए एक अदद चीज की जरूरत होती है जिसके ऊपर पूरे मुल्क में फड्डा है, और वो है इलेक्ट्रिसिटी। सबसे महंगी आपका वो है कंपोनेंट, सबसे ज्यादा फड्डा इसी पे है। और कितना यूज होता है हम उससे बात करते हैं। सही है, सो लेट्स ब्रेक इट डाउन। लेट्स से एक सर्जिकल ड्रिल और सॉ यूज अबाउट 100 to 300 watts of electricity. Electrocautery सर्जरी हो ही नहीं सकती उसके अंदर, यूजेस अराउंड 200 watts of electricity. Suction pumps again तो बगैर नहीं कर सकते आप काम, 200 watts. Monitoring devices around 500 watts. Operating room lights 100 watt each. These are the LED lights I'm talking about, 100 watt each, and around 2 to 4 lights are required. General writing 500 watts, and then this is the heating and ventilation system, that is all around 3 to 6 watts. So a typical OR in 1 hour burns around 110 kVh of electricity. And to put it into perspective, that is around equivalent of powering a house for 1 day. तो भाई आप जितनी बिजली आप एक दिन में जलाते हो, एक OR उतना 1 घंटे में जला देता है, ठीक है। सो next up we have anesthetic gases. We normally use, I don't know if you are guys are like familiar with it, nitrous oxide sedation तो तुम लोगों ने सुना होगा. Desflurane is something that is used to for induction of anesthesia. These gases have a high global warming potential, okay. And for like, if I put over here like a small picture over here, like एक आपकी गाड़ी जो है उसके बराबर एक राउंड ट्रिप, आई एम जस्ट गोना शो यू इट लेटर ऑन, एक राउंड ट्रिप कितना होता है और एक नाइट्रस ऑक्साइड या डस्ट फ्लूएंट कितना आपका बर्न करता है, ठीक है। आई एम जस्ट गोइंग टू शो यू नेक्स्ट अप, sterilization and water use. Okay, so autoclaving and instrument cleaning is a process that requires water. We all know that. एक normal autoclave अगर आप लोग clinics पे काम कर रहे हो, you all must know that around 2 to 3 liters of water is required in a single cycle. और आप ऐसे चलाते भी नहीं हो। Let's say कि वो आप चला भी दो तो the electricity it is going to use it is another story. This is like for आपका छोटा होता है जो clinics में normally cute सा रखा हुआ होता है। जो बड़े वाले autoclaves होते हैं like the one in this picture, this uses around 80 to 100 liters of water in a single cycle, ठीक है। That is like कितना आपका एक घर का दिन का घर का आपका निकल सकता है पूरा यूज in that sort of water, into that sort of water use. So apart from that, we have chemicals and enzymatic cleaners and disinfectants that have environmental impact as well. Okay, so water waste segregation, let's come to that. That is again a big problem. Sizable amount of waste is produced when a surgery is done. सही है, कितना जनरेट हो रहा है हमने बात कर ली उसके ऊपर। अच्छा, देन अगेन आपके पास बायोहैजर्डस वेस्ट भी होता है और नॉन हैजर्डस वेस्ट भी होता है, ठीक है। आप एक्सट्रैक्शन करते हो या आपने कोई भी प्रोसीजर किया, आपके ब्लड सोर्स गॉस भी उसी आपकी डब्बी में पड़े हुए हैं, सब कुछ आपका उसी आपकी यूनिट पे पड़ा हुआ होता है। आपका एक असिस्टेंट आता है, आपने अगर नैपकिन बिछाया हुआ है तो वेल बेटा वो नैपकिन को आएगा, रोल करेगा, बगैर कुछ सेग्रीगेट किए वो उसी डस्टबिन में डाल देगा, सही है। I'm not saying everyone does that, but this is what normally happens in clinics and hospitals. मैंने एक प्राइवेट हॉस्पिटल में भी काम किया है, I've worked in government hospitals as well. प्राइवेट was a bit better, but गवर्नमेंट में तो ऐसे ही होता था कि the house officer or the student that was working used to dump it in the same uh, trash can that was lying over there, और वो सारा कचरा एक ही जगह पे जा रहा होता था, उसकी कोई वो नहीं होती थी डेजर्टिस टॉर्नाडोस की मार्किंग उसके ऊपर। भाई आप मेटल भी उसी में निकाल के फेंक रहे हो, आप जो है आपने स्पंजेस यूज किए हैं वो भी आपको उसी के अंदर जा रहे हैं, और अगर आपका कोई टिश्यू का पार्ट है तो वो भी उसी के अंदर जा रहा है। दिस नीड्स टू बी सेपरेटेड, दिस कैन कॉज अ लॉट ऑफ डिजीजेस। और जिस तरह से हम लोग अपना वेस्ट डिस्पोज ऑफ करते हैं, दिस नीड्स टू बी एड्रेस्ड, एंड देयर आर लॉज फॉर अबाउट दैट एज वेल। आई एम जस्ट गोना कम टू दैट एज वेल। ओके, this is that some hospital waste management rules 2014. This was an act passed in 2013 and made a rule in 2014. Sorry, after the Sindh Healthcare Commission that came into being in 2013. After that, this rule was passed. It its para 13 states that an authorized officer can inspect any hospital located within the area of jurisdiction to check the provision of rules that are compiled by the hospital. Okay? It is an authorized officer finds any contravention of any provision of these rules, he should take legal action. We do have a rule. There are guidelines provided by the Sindh Healthcare Commission. There are guidelines provided by this law, but how many of are we following? ठीक है, गवर्नमेंट ने भाई रूल तो बना दिया है. Now, how much is the government actually wanting to like implement it? ठीक है, how much are the officers interested in that? And plus, one more thing, do they know about the consequences that are going to follow? Okay, so like let's talk about the sustainable practice that can be done. We are going to talk about the waste reduction. We are going to talk about telemedicine. We are going to talk about energy efficiency. We are going to talk about switching to low green warming potential gases as well, right? So, like I said, 10 रेन का 1 घंटे का जो मैक का वैल्यू है दैट इज अराउंड 320 किलोमीटर्स ऑफ अ कार, एक राउंड ट्रिप आपने ले ली, ठीक है। नाइट्रस ऑक्साइड का इज अराउंड 95 किलोमीटर्स। सेबोफ्लोरेन और आइसोफ्लोरेन जो कि बेटर ग्रीन हाउस फ्रेंडली गैसेस हैं, दे आर अराउंड 6.5 to 14 kilometers. So it is most of the countries worldwide have switched to isoflurane along with propofol for anesthesia, but I have seen some hospitals, I have been to some hospitals that are still using nitrous oxide and still using dusturium. अच्छा, the thing, what is their argument is that कि dusturium का जो आपका पेशेंट वापस आता है एनेस्थीसिया से वो मैक्टली कम है, तो इस वजह से it is easier to bring them back. But then again, at what expense? Like अगर सिर्फ के अंदर आपका टाइम लगा है 5 minutes, तो 10 मिनट के अंदर 89 मिनट्स ज़्यादा लगता है, एंड फॉर दैट दिस द पेशेंट नीड्स टू बी मॉनिटर्ड, नथिंग एल्स. सो 3 minutes more and a carbon footprint आपका लाइक इतना मैग्नामिनस अमाउंट अगर आप कम कर सकते हो तो व्हाई नॉट. देन waste reduction, people we need to like sort our waste. The waste that is non-hazardous needs to go at one place. The hazardous or the bio-friendly waste needs to go at one place, right? We need to use, we need to go towards recycling non-contaminated materials. We need to stop using single-use plastic instruments. That is very important. आजकल trend बनता जा रहा है. We need to stop it. There is no point of it. अगर आपका sterilization सही है, it has been properly sterilized, your instruments, there are no need to uh, use plastic instruments. ठीक है? Okay, energy efficiency. One thing that is in fashion these days and it is like very effective are solar systems. Hospitals have been adopting them. Houses have been adopting them. I've seen some clinics adopting them as well. Like my supervisor just recently installed a solar system. Reason being the same, भाई एक तो बिजली बहुत महंगी है, plus it is आपका energy efficient. Like the solar system is charged in the morning. He starts his clinic around like 3 p.m. He has a battery installed. Backup hours like 5 hours. It goes on. He finishes his clinic around like 8, and he's like, I'm satisfied with this. Okay. So reusable energy. Then we have LED lighting. Mostly अब जो units आ रहे हैं, they are equipped with LED lighting. आपके ORs have LED lighting, but still there are some units and there are some ORs who are still using those halogen lamps. So they are bad for you. Don't go for them. They are bad for the environment. Optimizing HVAC systems. भाई अगर 3 AC लगाए हुए हैं आपने और उसके अंदर 8 410 यूज कर रहे हो तो please get rid of them. We have environment friendly gases, we have environment friendly gases. Do get them. And then last of all, but not the least, educate your staff. वो बंदा जो आपका यूनिट क्लियर करता है, टेल देम कि भाई आपको जो ब्लड सोप्ड स्पंज है या जो tooth है या जो आपको जो भी मटेरियल है, it doesn't go in the same waste bin as all other stuff. It has to go into a different waste bin. You have to uh, sort it out. Your syringes or your sharp items go into a proper danger box. Okay, so that is right. There is another case study or telemedicine I wanted to discuss about. I hope most of you know about orthodontic surgery. So what we do is that there we need to make a splint. Okay, हम लोग एक स्प्लिट बनाते हैं कि हम लोग इस जॉ को जब मूव करते हैं तो हम एक स्प्लिट बनाते हैं मोस्टली टू प्रोटेक्शन परस्पेक्टिव, क्योंकि अगर हमने इस जॉ को मूव कर दिया तो हम नीचे वाले एक्लूजन कहाँ से अचीव करेंगे. सो व्हाट वी नीड इज आपका स्प्लिट दैट गोज इन. इट्स लाइक ऑफ वेफर. अगर आप लोगों ने कभी देखा हो तो, अगर नहीं देखा तो लेट्स से कि अगर ऑटो पोजिशनिंग स्प्लिट या जो आप अपने मायोफेशियल पेन में देते हो उस तरह का ही होता है. ठीक है, तो इट्स काइंड ऑफ दैट. अब उसके बनाने की लेट्स टॉक अबाउट द एनर्जी इम्प्लीकेशन एंड द टाइम रिक्वायर्ड इन अ कन्वेंशनल वे. ठीक है, अपर और लोअर जॉ का इम्प्रेशन लेते हैं एंड इट इज सेंट टू द ऑर्थोडोंटिस्ट. द ऑर्थोडोंटिस्ट विल माउंट इट ऑन द आपका जो आर्टिकुलेटर होता है अलॉन्ग विद द जॉ रिकॉर्ड. ठीक है, he is going to send you back. बोलेगा कि अच्छा हाँ ये सही है. He is going to send it back to you and then you are going to perform a model surgery over it. ठीक है, once the model surgery is done, the model is going to go to the lab and then a splint, they are going to make a splint for you. ठीक है, अब उसके अंदर you at least need 2 to 3 models for आपका 2 to 3 because it is a multi-stage surgery. सही है, तो you need at least 2 to 3 models for that. कंपेयर टू दैट अब हमारे पास आ गई है वर्चुअल सर्जिकल प्लानिंग. ठीक है, वर्चुअल सर्जिकल प्लानिंग में क्या करते हो आप, इंट्राओरल कैमरास होते हैं और इंट्राओरल स्कैनर्स होते हैं. यू टेक द पिक्चर, स्कैन द पेशेंट माउथ. आप एक सीबीसीटी करवा लेते हो पेशेंट का, वो तो आपको नॉर्मली भी करवाना ही है फॉर द ऑर्थोग्राफिक सर्जरी. सही है, उसके साथ प्रोसेस हो जाता है. यू जस्ट पुट इट ऑल इनटू सॉफ्टवेयर एंड यू जस्ट पुट इन द रीडिंग्स एंड यू टेल द सॉफ्टवेयर कि भाई इतना आपको बना के देना है मुझे. लाइक लेट्स से कि मेरी जो ईएमडी वैल्यू है वो आपकी -3 थी एंड आई वांट इट टू बी +3, या एसएनए मेरा जो था वो 74 था, आई वांट इट टू बी 80. सो मेक इट like around that. So it is going to do that for you, and the splint is, and you can just 3D print the splint, right? So इसका इम्पैक्ट क्या हुआ भाई. मेरे पास मेरे क्लिनिक में पेशेंट आया. ठीक है, मैंने अपने पास से ही स्कैन करके एक डिजिटल फाइल ऑर्थोडोंटिस्ट को भेज दी. ऑर्थोडोंटिस्ट ने प्लान किया और जिसके पास 3D प्रिंटर था उसको भेज दी. ठीक है, नाउ all of the time, the money and everything that energy that was required, वो सारा कट डाउन हो गया. मेरे पास एक कंप्यूटराइज प्रिंट आ गया डिजिटली प्लान. कंपेयर दिस टू दैट कि जो एनर्जी और वो रिक्वायर्ड था, इट हैज ऑल बीन कट डाउन नाउ. ठीक है, सो दीज काइंड ऑफ प्रैक्टिसेस नीड टू बी इनकॉर्पोरेटेड इन योर प्रैक्टिस. लाइक वर्चुअल सर्जरी की प्लानिंग की तरफ पूरी दुनिया आ रही है एंड वी नीड टू कम टुवर्ड्स दैट एज वेल. ओके, so this is from my side from a surgical perspective. Thank you for your attention. These are my contact details and you have been a lovely audience. Thank you. Any questions?